Max tells me that our screen up here is not acting normally, so I brought my laptop just in case I do need it, and I'm going to put that there. So, as always, thank you for the time today for this COVID-19 update. Best wishes to everyone on our board and listening to us through the community update for the new year. Gotcha. There we go. So at this point, Buncombe County has surpassed 34,000 total COVID cases. In addition, we have lost 454 neighbors as of yesterday in COVID-19 related deaths, with a dozen occurring in the last couple weeks. And today, I wish I was bringing you good news for this new year, but unfortunately, in terms of our local metrics, there's not much good news to share. As case rates are currently skyrocketing, there we go. As of yesterday, we were experiencing 654 new cases per 100,000 per week. This is a tremendous increase from the last month when our rate was around 200 new cases per 100,000. And this is far greater than what we saw at the peak of the winter 2021. So that's starting in December 2020 into January and February and March of 2021. It's much larger than the peak that we saw in the winter of 2021 surge just a year ago. And in a couple of slides, I'll show you that illustration through our Epi Curve. Additionally, the percent positivity has increased to 13.7% as of yesterday. This is also a significant increase from just 1 month ago when I presented to you all last, when the percent positivity was about 6.6. Our death rate saw a decline in the last week, but remains very high with 4 additional deaths added. Also troubling is our steadily increasing hospitalizations. Dr. Bill Hathaway is joining me today and will provide more insight on the impact of our current surge on local hospitals. But in short, the percent of inpatient beds occupied by COVID-19 is increasing and is now close to 10%, which would be that warning zone. I am going to show you the Epi Curve and go back to the previous statement and discuss it a little bit in the context of this epidemiological history. And what you're seeing right now is our Buncombe County COVID-19 story in peaks and valleys since March of 2020. Our current surge is at the far end. Now, if I zoom in and just show you the Epi Curve from December 2020, which is showing right now, and what that's about the surge from last year until now, you can see the stark difference between the peak of last year's surge around this time and the peak and what we are seeing right now with the current Omicron surge. It is considerably more steep and higher. You can also see that precipitous rise in cases in the last couple of weeks, with the week prior being the most significant so far. That far end Epi Curve was already looking fairly steep in its incline. In the last couple of weeks, that has just exponentially increased, as you can see there. This surge appears to be dwarfing any of those of the January 2021 and the Delta surges in comparison. It's also happening very quickly and spreading very rapidly.
Stacie, a quick question. Based on that Epi Curve, can you tell or have a best guess on the approximate start date of our Omicron wave, of roughly when it entered the testing data for the county?
It's likely that we were seeing it, so after Thanksgiving we had seen a slight decrease, and then we plateaued pretty high and then started seeing it increase again. And though while sequencing wasn't showing a lot of Omicron at the time, I suspect that we were starting to see it then. So those weeks after Thanksgiving in early December, we were likely starting to see the increase and the effect of Omicron, and now most certainly after the holidays, seeing it tremendously more. I will say that the North Carolina Department of Health and Human Services respiratory report that shows the sequencing, it's about a week behind or so, and its most current week, I believe, was like December, maybe 11th or mid-December. It was still only showing less than 15%, I believe, Omicron. I suspect that when we see the respiratory report update this week and into the next week, that we'll see it much more considerably, the burden of COVID cases at this point. So because of the case rates and their exponential increase and seeing much higher levels than our previous surges, and knowing that our currently circulating Omicron variant is far more contagious than previous iterations, and that our hospitalizations are increasing, and because right now, while new at-home therapeutics are available, they are limited in supply throughout the state, I am recommending that the face covering requirement be extended to no less than February 9th, and strongly recommend that it be extended until February 23rd. As I've said before, there may be a day in the near future when we can tolerate higher case rates and move to general public recommendations, particularly when our at-home therapeutics are more readily available in greater supply, so that we can keep more people out of the hospital, but that day is not today. I'm going to move on now and switch gears a little to our testing initiatives. And spend a little time talking about what testing efforts we have in our community. There are numerous testing initiatives in place within the community, including fixed site testing, community pop-ups, and retail testing options. I did want to highlight, you'll see on the screen there that our Harrah's Convention Center is continuing to operate. We did hear this morning that those hours may be changing from 12 to 3 p.m., but I'm waiting for official confirmation on that, as the North Carolina Department of Health and Human Services website still shows that as 10 to 2. But there are numerous places and testing providers within our community. I did want to highlight the testing efforts in place in our school systems that utilize rapid testing conducted by school nurses and other trained personnel to help quickly identify suspect cases prior to presenting to the classroom, testing of close contacts when necessary, and testing individuals throughout the course of the school day that may present with symptoms consistent with COVID-19. And Buncombe County HHS has supported the school nursing leadership and team in implementing these testing initiatives that are then coupled with the North Carolina Department of Health and Human Services Strong Schools Toolkit to ensure our learning environments are safe and as healthy as they can be, so that our children can remain in-person learning, which we know is not only beneficial for their intellectual growth, but also their social and emotional health. So special thanks to the school nursing teams and our school nurse leadership, particularly April Bauer, and our school systems leadership for their commitment to healthy and safe learning environments. Additionally, our community is fortunate to have community health worker programs that provide support, education, and linkages to COVID-19 resources, including testing and vaccine in our communities. The community health worker groups are very similar to the community ambassador programs that Commissioner Wills shared with me earlier in the week. In our community, we have groups like IFA, which is the Institute for Preventive Healthcare and Advocacy, led by Kathy Avery, UNEDI, and Healthier Together, who all utilize the talents and skills of community health workers. And all these groups have one thing in common, which is equity is the focus of their work. And just to give you a couple of examples of what testing efforts are happening in that space, IFA has routinely visited communities throughout Buncombe County, going door to door to, one, listen to the concerns, two, provide accurate and trusted information by those community health workers who are a part of the community in which they work, and three, connect individuals to services like testing and vaccination. Specifically, IFA has provided approximately 400 at-home rapid tests to members of the community. And just while I'm mentioning the work of the community health workers, another example, this time on the vaccine side, Healthier Together was instrumental in the Biltmore Church vaccine outreach collaboration with the Mexican consulate that occurred in October. Healthier Together worked with Latinx communities to get the word out about the importance of vaccine, provided those communities with accurate information about the vaccine, and worked with Buncombe County HHS to provide a welcoming and accessible space for a 4-day event in which for community members to receive their vaccine. So many thanks to the numerous community health workers within our county, and many of whom have worked out throughout our region to provide those services. And just to briefly tell you about some new testing initiatives that are on the horizon for Buncombe County. Buncombe County HHS is building off that model of the community health workers and purchasing a supply of rapid at-home test kits for community distribution. Staff is currently working to have tests hopefully arrive next week. This will heavily be dependent on vendor supply, which has changed quite a lot in the last week or so. We plan to work with our existing partners in communities to have rapid tests available in their locations for distribution and pickup by community members. Locations may include community centers throughout the county, fire departments, homeless shelters, libraries, churches, even at some of our vaccine events, and again, with our community health workers. So details about that initiative will be finalized upon the receipt of those test kits and dependent on the quantity in which we actually get to receive. In addition to tests, the plan includes providing prepackaged face coverings to those selected community locations for distribution to the public as well. So I just did want to mention that for folks who are already utilizing at-home rapid testing, I want to remind everyone that those tests are heavily relying on you getting a good sample. So please follow those directions closely. And also that rapid antigen at-home tests are most accurate when viral load is higher and when symptoms are present. They can be less accurate for those who do not have any symptoms or have lower viral loads. So this is why most typically we're using them for those who are experiencing symptoms or are known to have a confirmed exposure to a positive case. And then lastly, I did want to mention that there are opportunities for additional testing surge resources with FEMA and North Carolina Department of Health and Human Services, both of which I have submitted proposals for, and those are pending. And those would be not just for Buncombe County, but would help service other surrounding areas as well. And now we're going to move on to vaccine. And I'm going to go pretty quickly through this. When I last presented, Buncombe County was getting ready to wrap up our pediatric vaccine events. And we completed our Saturday at School events prior to the public school release for winter break. Between Buncombe County, HHS, and MAHEC and FEMA partners, we administered over 1,200 doses of vaccine with this campaign. In addition, the Eddington Center was set up as a state vaccine site for pediatrics and administered over 630 doses. So I just wanted to thank all of the vaccine providers, particularly in that campaign right before the winter holidays, for all their efforts, and did want to remind folks that we have our HHS fixed sites still operating and administering 300 to 400 doses per week, and other vaccine providers are available through retail pharmacies, medical providers, and others. What's on the horizon for vaccine? I'm sorry. Sorry, just skipped ahead. So as a result of the concerted effort by vaccine providers in Buncombe County, we've seen about a third of our pediatric population receive their first dose in about 2 months' time. Additionally, we see our adolescent population catching up with our 18 to 24-year-olds and soon approaching 60%. Our populations that are 25 years and older are all now reached 70% or more, again, with our 65 and 75 and older population having the highest rates. Overall, 71% of our eligible population, that's 5 and up, have received 1 dose of vaccine, and 68% of the eligible population has been fully vaccinated at this point. When I last checked a couple of weeks ago, about a little over 40% of those who are fully vaccinated have received a 3rd or booster dose. So I'll be able to connect with Department of Health and Human Services again before our next meeting and give you an updated number.
That 40% is based on what date?
That's a couple weeks ago.
Okay.
There we go. So future vaccine planning. So what's on the horizon? Knowing that we do still have some work to do in helping folks get to their booster status, our future efforts will be focused on giving the new year a boost, focused campaigns on boosters, and revamping regional messaging to inform, encourage, and remind people about their boosters. Additionally, we are already doing early planning for the adolescent boosters. Just this week, FDA has authorized boosters for 12 to 15-year-olds. However, remember that's a multi-step process. The CDC has not provided their recommendation at this time. So in anticipation of those boosters for that age group, our public health operations team has begun prelim planning for similar Saturday events, building off the success that we had before the winter break. And our team will be engaging with school partners in the coming days to discuss and finalize those events.
Stacie, a question about the boosters.
Yes.
Do you have a sense for the congregant living facilities about boosters for those, and how many of them have already taken care of that or still have need?
So we continually have been going out to the long-term care facilities who needed support for vaccine. I can get those numbers for you. I don't have them with me today about what number that we've done that were boosters for that. And then what we found is many of the large long-term care facilities have taken care of that through either commercial partners or through their own staffing. So I will get a number for you for what we've been able to do. Yeah. And so just a reminder for those who are still in need of vaccine, please visit the myspot.nc.gov to find a vaccine provider near you. And then just in summary, to close us all out before Dr. Hathaway provides some information, there are just some key things right now with Omicron spreading essentially like wildfire that I want folks to remember, and these are: get vaccinated, get boosted when eligible, get tested if exposed or experiencing symptoms, get your face covering and wear it when you are in indoor public spaces, get some distance between you and others, and get those hands clean, sanitize, and wash them often. Please help us boost our new year and hopefully reduce the spread of COVID-19. That's all I have for you today. Happy to answer questions, or I can turn it over to Dr. Hathaway for the hospital perspective.
Stacie, I guess one question or comment, going back to your testing slide about the rapid antigen testing and trying to find that supply, and I know every person in North America is trying to find one right now. I think it sounded like there's money from NCDHHS to do that for 5,000. Is there a scenario, is there a scenario which we could use our own funds to purchase, triple that, or is it more of a supply constraint than?
I'll tell you about what we're doing so far, and then allow County Manager Pinder to weigh in. So we do have funds through an agreement addenda, an ELC, which is just that expanded testing protocols and funding that is AA 543 that will allow us to purchase. And so we have funds that can purchase up to 5,000 right now. We did want to limit that to a limited supply at first until we see how quickly they get distributed and how quickly they get picked up. There's potential for us to use more of those funds. They are also the funds that we use to help support our temporary and contract workers that are in that working in that space too. And then beyond that, it would be discussions if we found that our budget in AA 543, that those ELC testing funds could not cover any more, we would be coming back to Command Center where county leadership is to request further discussion.
Can I ask a follow-up question? I just want to make sure I heard that correctly. So at this time, you believe the county has resources to purchase additional tests, and that would need to come out of the COVID response funding that the commission has approved from the Recovery Act funding. Am I hearing you correctly?
That's correct.
Okay,
Right
just
now,
wanna make sure.
Public Health has specific funding through this agreement addenda with the North Carolina Department of Health and Human Services that we've been using to help fund contracted and temporary staff, other testing resources, and we can use this funding to purchase these tests. That is an allowable.
I just want to make sure I have all my acronyms straight.
Yeah.
There's a lot.
And to Parker's question, so in the event that that money expires, we do have that $1 million that you guys allocated from ARPA. We have used some of that already, though, but there's still money there that we could use to buy additional. But the reason why I asked Stacie to only do 5,000 at this point is the state and the federal opportunities that are going to be sending us testing. So my goal was, this is a bridge, is how I was framing it. This is a bridge to get us to when we get state testing or federal testing. In the event that that doesn't come through, we have more funds that we could buy more.
Thank you for that reminder. That's correct, that there are two other avenues that we will be learning more information about. One, the federal avenue to get at-home tests to Americans at their home. More details are going to be coming about, like, what are the real logistics about that? How do people get them? And then through the Department of Health and Human Services here in North Carolina, we do already have some avenues for folks to get at-home testing collection kits that then are sent off and have a fairly quick turnaround. But also there is a movement to get at-home rapid tests, like the antigen test that we're ordering, at a state level too, that local health departments could order a supply of as well. So this is that bridge until we learn more about what those two programs may or may not be able to do.
I guess last question about, kind of shifting a question to PCR test capacity. I've been trying to find this, in other places in the country like DC or New York where Omicron is kind of spreaded faster ahead of us. I can't tell if there's generally enough capacity, if these labs are running out of the ability to test this many individuals.
That's a great question. And so over the last 2 years, we have built, not just in North Carolina, but nationwide, laboratory capacity for this. And so what I think you're seeing now is not necessarily a lack of capacity. It is that the demand is so high because of how quickly Omicron is spreading right now, that just the sheer numbers at this point are just so large. And because of, we're almost at 700 cases per 100,000 per week. We've never seen a number like that in the time that I've been recording data for us. That alone means that there are probably many more cases that are not being reported, right? And so we just have so much spread right now. And so what you're seeing is, I don't think what you're seeing is necessarily a lack of capacity, because that has grown leaps and bounds. And at the governor's briefing two briefings ago, they mentioned like how large they had grown that North Carolina lab capacity. I think what we're really seeing is that this particular iteration of the virus is so much ahead of us that we're playing catch up with it. And so I just want to remind the community that yes, there are probably going to be some long lines, and we can that can be fairly tolerated because there's just so many folks who need testing, either because they're having symptoms or they know now that they have been confirmed as an exposure to a positive case because it's spreading so quickly. So just a reminder, if you're having symptoms, seek out testing. Just remember, if you're going to be using at-home testing, to follow those directions, because it does really rely on you getting a good sample. Make sure that you isolate if you're having symptoms, and continue to just do the basic types of things that will help us reduce the spread and that will protect you. Wear your mask, keep some distance, wash your hands, limit your interactions. Like this is going to be a really hard few weeks.
I had one follow-up question about testing in the rapid test. You mentioned that the rapid tests are less likely to be accurate if a person doesn't have symptoms, right? If a person doesn't have symptoms, based on what we understand about the Omicron variant now, are they still possible for them to spread to other people, even if they're non-symptomatic and would be tested and the test would come back negative?
Yes, all of that's still possible. The difference between sort of the traditional PCR and what we know, like when folks talk about rapid, they're typically talking about rapid antigen tests. And so I just want to make sure that, folks understand there are different types of rapid tests. Some of them are even PCR. But traditionally, folks are talking about the difference between a PCR and a rapid antigen. And PCR is what we consider that gold standard, right? What we know about rapid antigen tests is that they are most accurate, most sensitive when folks have a higher viral load or that they are symptomatic and in that very infectious period. They tend to be less accurate and less sensitive when folks have lower viral loads or asymptomatic. And so we just want to caution folks to remember that.
And so they're less infectious, but still doesn't mean they're not infectious. Did you say
That's
they're
right.
less-
Does
they're
not mean
less
that they're
infectious?
not infectious.
Okay.
It means viral load may be lower.
Okay, thank you. Robert?
Yes, Stacie, this might be a question. With this big spike we're seeing now, after the holidays and everything, have you got any numbers to show how many people that have had the full vaccine booster that it's affecting?
Yeah, and so in general, I have statewide data, which we can assume, like, we're no different than the rest of the state. So, we have much better aggregate data around statewide numbers. What I can tell you is the last respiratory report, it has been fairly consistent that about anywhere from 15 to 20% of all the infections that we're seeing are post-vaccination infections. So that's been pretty consistent for a while now. What you're probably hearing more about is that we have a lot more people vaccinated, right? So when that denominator, when that big number changes to even a bigger number, that 15 to 20% now is a bigger number of actual individuals that you're seeing, right? But the percentage, when we look at all the cases, it hasn't changed that much. It's still teetering somewhere around the 20% mark.
All right, thank you, Stacie.
Welcome, Dr. Hathaway.
Dr. Hathaway, thanks for being here.
Thanks for having me. I always appreciate the opportunity to be here. Stacie did such a nice job of covering just about everything. I hope my update's brief, and I'm happy to take questions. To echo Stacie's major point is the transmissibility of Omicron is really unbelievable. If you notice, we had about 11,000 cases per day on our number of cases on the state Epi Curve during the last peak, and we had 19,000 just a few days ago. So there's a dramatic increase in the number of cases per day. The silver lining, and I wouldn't even call it silver, let's call it nickel lining around this cloud, is that it appears to be less virulent. It causes less severe disease. And so if it had been as virulent as Delta or any of the other strains, we would be overwhelmed with hospitalizations right now. The good news is we haven't seen that yet, but we're still on the upward trend of the hospitalizations in our community and across the state and across the country. The total number today in our system, so all 7 of our hospitals, was 113 patients hospitalized. 84 of those were adults, and 4 of those were children. That is in comparison to our peak numbers, which were actually in January of a year ago, which was over 180 patients in the system, and a peak at Mission Hospital of around 135 to 140. So we're still far below that number, but because of the tremendous numbers of infections, even if it's a smaller percentage, it's going to be a high number of hospitalizations. As Stacie pointed out, we've seen that the numbers of patients who are hospitalized who have been vaccinated is a very, very, very small percentage overall, relatively small percentage overall of the total numbers of hospitalizations. The numbers that we have, and I'm just going to be totally honest with you, it's difficult to track who's been vaccinated or not because we're reliant on self-reporting from the patients, and so it's not always clear. But it was between 5 and 10% of our hospitalizations right now are vaccinated. I suspect that number is a little bit higher, and those who have been boosted comprise an even smaller number of those. So the point there is, as Stacie emphasized, and I'd like to repeat, is the vaccines are safe and effective. the vaccines work at decreasing severity of illness, hospitalization, and likelihood of death. And so even if you get infected, and we will all hear stories about people who've been infected, who've been vaccinated and boosted. My son is one of those. The good news is he had very minimal symptoms, barely knew he had a cold, and that's what we're striving for, turning this virus into an endemic illness that we can live with and keep people out of the hospital and keep people from getting severely ill. We are hopeful that some of the newer therapies that are to become available that have been approved, including the oral therapies from Pfizer and Merck, which inhibit viral replication so the virus can't reproduce in your body, will have an impact on our community going forward. The problem is they're just not available. They're just in such short supply right now that it's going to be a while. So don't count on that as your backup for when you're not vaccinated. Get vaccinated. And if I haven't mentioned it before, get vaccinated. The last thing I'd like to mention is we've done some sophisticated analytics through our parent company at HCA to look at when we think we might be seeing the peak of this current pandemic. There is data out of South Africa which suggested a 4-week course to the peak. And so that would put us somewhere into mid to late January when we'd start to come down. It was interestingly, in comparison to the prior peaks from the surges, this is, as Stacie showed in her Epi Curve, a very steep and rapid rise. And we expect a steep and rapid decline, or we're hopeful for a steep and rapid decline once we see the decline. I think that covers the bulk of the points that I wanted to make, and I'd be happy to entertain any questions.
Any questions, commissioners?
Dr. Hathaway, I got a couple of questions.
Sure.
You mentioned the hospitalization data. I've tried to determine this, I guess, on your website, but is that taking into account both patients that are hospitalized with COVID and for COVID? Do you separate those numbers? Or how do you
sorry,
kind of
with
calculate
COVID and?
I guess a person that's hospitalized with COVID as opposed to hospitalized for COVID, as in they show up for a different reason,
Yeah.
end up having.
It doesn't separate those out, but the vast majority are hospitalized for COVID. Okay. It's what we do is we look at the positive test in relationship to the date of their admission. So we've had some patients who've been in the hospital who test positive. They'll be there for 6 weeks for other reasons. That's no longer considered a COVID hospitalization. But if a patient comes in with acute gallbladder problems, coincidentally tests positive and has COVID, they're included in that number also.
Okay. I've heard anecdotes and rumors which happen, and people email me those things.
Sure.
Of course.
I get those emails.
Yeah,
too.
yeah. But I guess as a follow-up, are all types of patients that end up in your system, are they tested for the coronavirus?
No, so we only test if there's an indication to test, if we believe that they have COVID. So this is not, we have 700 plus patients in the hospital right now. We don't test each of those for COVID, and then a certain number of those coincidentally have COVID, but they're in for knee surgery as an example. That's not the case. These are really COVID cases.
Okay.
For all practical purposes, with perhaps just a very, very, very small number of exceptions.
There's some category of people that, like I think I was at Mission for like an hour a couple weeks ago for something unrelated, and I was of course not tested, but I assume there's some category of people that are.
Yeah, we test, so our testing policy is to test when there's an indication. They come in with signs or symptoms of COVID illness, which of course are upper respiratory illnesses, pneumonia, et cetera. And we do screen high-risk patients who are undergoing elective surgeries. They would not have their surgery performed unless it was an emergency. They might be included in that number, but that's a minority. That's less than 1 or 2 a week, if that.
Okay. My final thought or question. I've read other communities across the country, whether it's hospitals or EMS units or whatever, they have a lot of staff out because they're sick.
Yeah.
Because of the coronavirus. Do you have staffing concerns, I guess, over the next month?
Yeah.
Are you?
Yes, we do. There's staffing concerns given the nationwide nursing shortage as an example. The other places where we have significant staffing issues, independent of the COVID challenges right now, but exacerbated by those, are in our food and nutrition services and EVS workers. We all know that unemployment is now dipping to very low levels. Those workers are in high demand by all of the tourist industry here in Asheville and other people, so it's a very competitive workforce. And so we have challenges in many places. We're using contract labor, offering overtime, surge pay, et cetera, all the strategies that we can have available to bump that up. And right now we're doing okay. We're not where we want to be, but it's a fine line between the demand and supply that we have right now.
Thank you.
Yep.
Dr. Hathaway, I think we hear from a lot of folks, particularly with Omicron, that it's not that bad, it's just like a cold. I might as well just go ahead and get it over with. Can you share with us any data research about long-haul COVID and why we shouldn't necessarily feel like it's okay to get it, it's just a cold? What are you seeing in medical research in regards to long-term impacts of having COVID?
Yeah, so a couple thoughts before I hit the long-haul COVID. The patients in our ICU and on the ventilators would disagree with this lack of severity. There is a segment of the population who's going to get severely ill. We're fortunate that it's not as bad as others, but it's hard to predict. We know there's certain risk factors for severe illness, but neither you nor I want anyone to believe that they should roll the dice. It's not a game of chance that you want to play. Long-haul COVID is really very, very interesting and intriguing. No one really understands or can fully identify the pathology of it. We believe it's in part related to the body's own response to the illness, and maybe even producing antibodies against the antibodies that we developed for in response to the infection. Lots of questions about that. The typical symptoms involve fatigue, this COVID brain fog. I was joking around that we all seem to be in a COVID brain fog, but this is a real illness where people just don't have the clarity of thought that they usually have. They have typical symptoms of what we call an autonomic instability. Those are fancy words. What does that mean? It means that their heart rate goes up too fast when they stand up. They're short of breath. They don't have the normal regulatory response to normal stimuli that you have. So you just feel terrible for a long time. There's some data out there that suggests that, interestingly, that vaccination afterwards may actually be helpful. That's in part anecdotal. It appears to have features which is in many ways consistent with what we used to call chronic fatigue syndrome. And then there's an illness called POTS, or postural orthostatic tachycardia syndrome, which is that, stand up, you get dizzy, short of breath, rapid heart rate. So lots that we're learning, but I think that's going to be an exceptionally intriguing, from a scientific point of view, field of investigation over the next few years as we learn more about it. Thanks for asking that question.
Dr. Hathaway, I have one question about the kids. Now that it's, it appears that Omicron, it really spreads a lot quicker than the other variants. Do you foresee that as we reopen schools, that we'll see a jump in Omicron from the kids, especially school-age kids?
Yes, just like we anticipated that Thanksgiving and Christmas with gatherings of family members in indoor spaces will increase spread, we know that any time where we're close together will increase. And as Stacie's data pointed out, we're still at, very minority. We haven't even hit 50% for the eligible pediatric population to be vaccinated yet. And so that's a group that is going to see increased numbers of cases. And then if they get the cases, they can spread them to the most vulnerable, and then they can become hospitalized. We have seen, both locally, we're at 4 peds patients hospitalized. That's about as high as we've been locally. It's not a very big number in the grand scheme of things, but it's higher than it's been. And we have seen trends out of New York and within our HCA hospitalizations across the country where there's an increase. It's still not a big number, but it should be 0, right? We don't want any kids to be ill or sick with this, potentially very serious illness. And so it's important to, again, as we've said before and we'll say again, get the vaccinations and get the series, and when you're eligible for the booster, get the booster. And kids too. It's safe.
Thanks.
Yep.
All right, commissioners, thank you for your questions. Dr. Hathaway, thank you.
Thank
for
you.
joining us
Appreciate it.
This evening, and Stacie, thank you and your team as well for all your great work. All right.